Glaucoma is the leading cause of irreversible blindness globally and the second leading cause of blindness in Nigeria. Primary open-angle glaucoma, which is the commonest variant of glaucoma in Nigeria, is initially symptomless, but with the increasing progression of the disease, there is visual loss which could be profound or even absolute. With increasing visual difficulty, patients find that tasks which define independence and productivity in the society, which non-visually impaired individuals find effortless, such as driving, reading, mobility, become unmanageable for them. This progressive loss of independence could significantly affect quality of life. The World Health Organization defines quality of life as a subjective perception of well-being and wholeness, and it is affected in a complex way by the patient's psychological state, physical health, level of independence, and social interactions. Glaucoma could affect quality of life in several ways. The psychological effect of being diagnosed with glaucoma, which is a potentially blinding eye disease, is immense. Patients could develop anxiety, depression, or fear of blindness from this diagnosis. The visual effects of the disease, the potential side effects of medical, surgical, and laser treatment, and the financial effects of this disease, which includes direct and indirect costs of managing this disease, could also affect quality of life. Several quality of life instruments have been developed over the years. Some are generic and can be used for a wide range of medical disorders, while some are vision specific for eye disorders. Some of the vision specific questionnaires are also disease specific. We noted a paucity of data on quality of life in glaucoma patients in Nigeria, and we sought to evaluate their quality of life because we wanted to understand the patient's experience of this disease and how the visual loss affects the activities of daily living. We wanted to compare two vision-specific questionnaires, one of which was disease-specific, the 15-item glaucoma quality of life questionnaire, the GQL-15, and the other, which was not disease-specific but was vision-specific, the 25-item National Eye Institute Visual Function Questionnaire, the NEIVFQ25. Our results showed that quality of life was clearly reduced in the glaucoma patients and that this reduction worsened with increasing severity of the disease. Both questionnaires were, however, found to be reliable. They had high internal consistency and good group validity. They also correlated strongly with each other in terms of the overall scores or the subscale scores. The GQL-15 identified the glare dark adaptation subscale as the subscale that patients have the most difficulty with, and this is important as glare and dark adaptation is not routinely examined or evaluated in our glaucoma clinics. The NEIVFQ25 identified the general vision and driving subscale as the subscales that patients had most difficulty with. In conclusion, we report that the GQL-15 and the NEIVFQ25 were useful and reliable in this group of patients in Nigeria. Thank you.